My name is Shirley Paradis, and I am going to persuade you that addiction is a disease and not a choice. If addiction were simply a choice, then people would also just choose to stop, but they don't. To avoid negative consequences like losing their families, their jobs, their homes, their health, and sometimes their lives. But they don't just choose to stop, not because they don't want to, but because it's actually a disease. Think of the pilots, attorneys, teachers, nurses, parents who've lost everything. Think of the children removed from their homes, professionals stripped of their licenses, and the bodies ravaged by substances. If choice alone could stop addiction, we would not see this level of devastation. Overwhelming evidence, despite overwhelming evidence, critics still claim that addiction is a choice, that it's a lifestyle, a moral failing, a weakness. But the numbers tell a different story. Between 1999 and 2020, according to the National Institute for Drug Addiction, over 800,000 Americans died from overdoses, and that's 40,000 lives every year in that time frame. It's grown since then. And while that might seem like a small number in a country of 340 million people, do me a favor and close your eyes and picture one person you love foaming at the mouth, seizing, swallowing their tongue, gurgling, turning blue, and not making it through an overdose. Open your eyes and multiply that by 800,000 people, and you kind of get a better picture. Addiction doesn't discriminate. I've met them all: pilots, doctors, construction workers, transients, rock stars, grandpas, moms. What makes me qualified to speak about addiction as a disease? I mean, nothing really, but speaking from experience, my mother was addicted to heroin my entire life. My father was a severe alcoholic. And I thought I would move my kids away from that environment, but genetics and trauma experienced couldn't be escaped. My son went through treatment at 24 years old. I work in a substance use disorder hospital, and I've taken classes in psychology and the sociology of addiction right here at WilMU. I was privileged to see Maya Salavitz, who wrote the book Undoing Drugs, speak at the University of Colorado School of Medicine, and I've read many books on addiction. When it comes to understanding addiction as a disease and not a choice, I highly recommend Gabor Mate's book, In the Realm of Hungry Ghosts, and I deeply care about this topic. And why is it relevant? It's because it's not just my story, it's our story. A 2024 study found that 21% of US college students meet the criteria for substance use disorder. That's 4 students in every classroom of 20. So if you look around a classroom one day and you think and spot 4 people that might be suffering in silence, then I feel like I've done what I set out to do here, which is bring awareness to the fact that people aren't just choosing to suffer in silence. It is the number one cause of injury-related death in this country. That's more than vehicle accidents, and it's more than gun violence. Addiction is prevalent, and it's affecting your peers. So this is why I set out to convince people to change their minds, that it's not a choice, it's not a moral failing, it is a disease, and I'll talk more about why I think that. Someone might choose to use a drug, but not everyone becomes addicted. Why? Because addiction is influenced by genetics, trauma, mental health, and environment. Addiction rewires the brain. It impairs judgment, decision making, and impulse control. Once addicted, the brain no longer works the way that it used to, or the way that a normal brain would. The American Society of Addiction Medicine says that it is a disease and that it's manageable and treatable. A disease of the brain's ability. This is one description. There's a brilliant TED talk on that I'll post in my references and provide the link for. A disease of the brain's ability to process benefits and consequences of choice, particularly if they involve dopamine, the brain's pleasure and reward system. Our brain's job is simple. It's to keep us alive. And this TED Talk goes on to say that it does that by recognizing that pain is bad and pleasure is good. Pain, we don't like it. Pleasure, we want more of it. Seems very simple. The brain uses the neurotransmitter dopamine to determine which of these we want and we don't want, what we want less of and what we want more of. It is the high before the high. So it's also anticipatory, meaning you're going to go out for that burger and you just can't wait. That anticipation is also dopamine's responsibility. So all drugs of abuse, even sugar, interacts with that dopamine system with the right environment and stressors, along with genetic propensity. It is more likely that addiction can begin. So addiction takes over the brain. It hijacks the brain's systems and tells your body that it must have that drug, sugar, whatever, in order to survive or at the very least feel better. Without getting into naming parts of the brain, I'll just say this. PET scans, MRIs, many studies have proved with no uncertain terms that this part of the brain that recognizes something is not right cannot communicate appropriately with the part of the brain that makes a decision to change behavior. In an addicted brain, those connections, they don't happen. So I've seen stigma firsthand, and a young woman in recovery was sent to the ER for swollen ankles, and the doctor greeted her with, quote, "So you're addicted to fentanyl." She wasn't seeking drugs, she was seeking care. And I often wonder if she had not been so ostracized, if she would still be here with us today. A man was dropped off at our clinic door, and we didn't have space to admit him. And so he went to the ER, he was released in the middle of the night, and was assaulted in a nearby park. He's a published author. He wrote 3 books. He holds a master's degree from a reputable Northeast university. And he's in recovery now. He's rebuilding his life, he's working, and he's reconnecting with his daughter. But what if instead of releasing this man as a man who chose to be a drunkard, we held him on what we call an M1 hold or a mental health hold, at least till morning, where maybe some different decisions could be made, and maybe social work could have gotten involved and possibly helped him. Another patient once told me that he didn't want to go to treatment, he wanted to die. And legal issues forced him into treatment. He later joined the military, got out of the military, went to school, is now a medical doctor, and called to say that treatment saved his life. So what if in the courts we treated people with compassion and treatment instead of like criminals? Because of a disease. So what if they got treatment instead of sentences? And this is a call to educate yourself and those around you, a pleading really to challenge stigma, to question what society says about addiction. Speak up and support those in recovery. Addiction affects everyone, not just the person using. And each of us has the power to change this narrative. Remember too that relapse is often part of recovery. It takes time to build resistance and coping skills. And they're not choosing to fail, they just aren't well enough yet. This TED Talk says they just didn't get the right dose of treatment for this disease. And I really like the way that that's put. Let's stop punishing people for being sick. Let's start healing and shifting the belief that addiction is a choice when it's a disease. Find reliable information at the National Institute of Health or the American Society of Addiction Medicine websites. Learn how to prevent an opioid overdose at cdc.gov. And please visit findtreatment.gov if you or someone you know needs help. At the end of the day, email me, call me, and I'll try to give you direction. Thank you.